on this wall. Ms. Peak and I are glad to be here to provide you with this update and for all Nevadans as well. I want to quickly begin with an overview of the national status. We've seen a 7-day average in new cases. We've seen the 7-day average of new cases in the United States exceed 70,000 for the first time, and more than half of the states are reporting case numbers at new record levels. In the last month, the number of hospitalizations from COVID-19 in the United States climbed about 45%. Hospitals nationwide are beginning to express concerns about being able to provide sufficient care to patients. Nationwide, trends are indicating that new cases are being driven by relatively small gatherings of families and friends, where folks are more likely to let their guards down. That's the COVID fatigue that the governor has been talking about, and it is setting in. As the governor mentioned on Monday, vaccines are in development, but we're not sure when they will be available to the wider public. As this data from the White House report shows, cases per 100,000 3 months ago, 2 months ago, and 1 month ago. As you can see, 3 months ago, we had a few areas of concern, but about a month ago, Nevada was doing pretty well. This graphic shows the data from last week. As you can see, we're seeing alarming trends in new cases in Nevada and across the United States. In this week's White House situation report for Nevada, we are again in the red zone. We're the 22nd highest state reporting more than 100 new cases per 100,000 residents. 71% of our counties have moderate or high levels of community transmission, according to the White House, and 24% of our counties are deemed in the red zone. That's based on the total number of known cases and high test positivity rates. That suggests that there may be even more cases than currently estimated or found through testing and contact tracing. That means, without a doubt, that we have community spread in the state of Nevada. Here's our latest reporting. On this slide, here's our latest reporting from the Department of Health and Human Services. This is a snapshot of the data we posted earlier today. There were 571 new cases identified yesterday. Of those, 322, or 56.4%, were in Clark County, 189, or 33.1%, were in Washoe County, and 60 cases, or 10.5%, were in the remainder of the state. There were 10 new reported deaths, 7,248 reported tests, and the 14-day test positivity rate is at 10.1%. For the most recent 7-day period, cases are growing at a rate of 0.8%, or 774 new cases per day. For some additional context, when the governor had a press conference last Tuesday, just 8 days ago, we were seeing 666 new cases a day. We are trending upward. As you can see on this slide, here's our testing data. As a reminder, we are working to meet a CDC goal of testing a minimum of 2% of Nevada's population per month, which would break down to about 2,200 tests per day, which we are meeting. In terms of cases from testing, we find cases of COVID-19, as you all know. As the governor mentioned last week, the number of newly diagnosed cases of COVID-19 began to increase at the end of September. We're seeing an infection rate above 1, which means the outbreak will continue to spread unless there are changes in our behavior to help mitigate that spread. The 14-day test positivity rate has climbed to almost 10%. Regarding hospitalizations, as we have seen in Nevada and across the country with previous waves or surges, an increase in cases almost always leads to an increase in hospitalization 2 or 3 weeks later. You can see that here. We saw an uptick in cases in July, and you can see hospitalizations climb in the state in August. Now for mortality. And unfortunately, we know from our experience that after cases surges come from hospitalizations, and then unfortunately deaths can occur. Again, you can see that phenomenon here from the summer. After cases and hospitalizations increased, you can see corresponding an increase in deaths for some individuals. It's all tied together. We do know that our hospitals have learned a lot in the last 8 months about caring for and treating COVID-19, but that's not through luck. That's through the hard work of our medical professionals each and every day to provide the highest levels of care. We don't want to end up like other states across the nation who are on the brink of implementing crisis standards of care measures. That means hospitals are rationing their resources and making evaluations of patients who have a better chance of survival, and that's where they are dedicating their resources. Crisis standards of care means gurneys in hallways. It means 0 visitors for loved ones. It means nurses and professionals struggling to find enough PPE to use. Nevada is not actively implementing crisis standards of care, and we want to ensure that it stays that way. I'm going to turn it over to Ms. Peak for a few minutes to talk about the status of our disease investigation and talk about what we are seeing in counties in Nevada at this time.
Thank you, Caleb. At this time, Nevada has found about 25% of the COVID-19 cases through contact tracing. That means there are positive cases out there we are not catching through contact tracing, which is an indicator of community spread. That's part of the reason we implemented and have been encouraging Nevadans to download and use the COVID Trace app. It helps supplement our traditional disease investigation efforts. At this time, we have surge staffing in place to help our contact tracing efforts, but those levels would drop down when the coronavirus relief funds expire at the end of the year. We do have grant money through the Department of Health and Human Services that will supplement these efforts, but we will be losing a good amount of staffing come the end of the year. On this next slide, we look at county data. I wanted to take a minute to break down some of that data and trends we are seeing by the counties. Some of you may be familiar with this graphic. Back in July, we began looking at data from individual counties and using 3 metrics to measure whether counties have an increased risk of transmission of COVID-19. If counties meet 2 of the 3 measures, they are considered at risk. We look at the average number of tests per day, how many cases per 100,000 residents, and the test positivity rate. This week, as the governor mentioned on Monday, 8 of the 17 counties are flagged for having an elevated risk of transmission. Washoe County has an elevated risk of transmission and has been for the last 5 weeks. Lyon County has been in an elevated risk for 3 weeks in a row. Clark, Elko, and Lincoln counties have been flagged for 2 weeks in a row, and this week, Carson City, Humboldt, and Nye counties were added to the list. We look at and update this data daily, and we do see some fluctuation, especially among our rural counties, of coming on and off the list. At this point, I'm going to turn the presentation back over to Governor Sisolak.
Thank you. Thank you, Caleb and Julia, for that thorough presentation. I hope you all were able to follow along. I asked Caleb and Julia to lay out some of our data so I could talk about the great balancing act of 2020 that I am working on every single day to achieve in Nevada. We don't mean to scare everyone with the data trends we're presenting, but we have an obligation to have an honest conversation with Nevadans about where we are and what will happen if we don't take this seriously. The public needs to understand that if we don't step up together and follow all public health measures, hard decisions and trade-offs lie ahead. The pandemic has been framed as a false choice. Shut it all down or do nothing. But we know that's not the case. We know that doesn't have to be our reality. We know we can't afford it. We can continue doing our best to balance the health and safety of Nevadans with the need to protect our economy, keep people employed, provide an education to our kids, and more. I promise that I am doing everything I can to manage this balancing act. And that balancing act in Nevada is perhaps the toughest than any other state. As many Nevadans know, we had to cut over 25% of our annual budget last time we shut down. That translates to real services the state provides to Nevadans. That was a devastating cut, and I'm doing everything I can to try to avoid having to do that again. Earlier today, I met with education and health professionals because I want more kids to get in-person learning in a safe and responsible way. I am so proud of our superintendents and education leaders for their commitment to safety. We're making a lot of progress, and I look forward to providing more updates soon. I'm also planning meetings with economic and business leaders and health officials too. That's because I don't want businesses to go under. I don't want people to lose their jobs. And I want to mitigate COVID-19 as much as we can to help people keep safe and stay healthy. That's part of the reason why I've empowered local communities from the start to take additional mitigation measures if their community is experiencing a surge. That's why we created the county tracker that Julia talked about. It's why we created a task force chaired by Caleb to take targeted approaches with counties that are experiencing surges. As many of you know, the COVID-19 task force has an emergency meeting planned for tomorrow with Washoe County, as Washoe County has been listed as having an elevated risk for the last 5 weeks. My expectation is that community leaders will come with a robust plan, and if that includes tougher mitigation measures, I will completely have their back. I think Caleb can talk a little bit more about how tomorrow's meeting will be set up and who has been invited from Washoe County.
Thank you, Governor. As the governor mentioned, after watching the situation unfold in Washoe County and after previous task force meetings with some officials, we've asked officials from across the county to come together and provide a comprehensive and coordinated plan to help slow the spread in Washoe. The people we've asked to join us include the Washoe County School District Superintendent, a representative from the University of Nevada, Reno, Washoe County Health District, Washoe County, the City of Reno, and the City of Sparks. I'm confident we'll be able to have a productive meeting with all of the stakeholders to truly evaluate what we are seeing and to come to a consensus on what steps are next for the county. Thank you, Governor.
Thank you, Caleb. So here it is, Nevadans. Here's my call to action to each and every one of you today. You've heard it from me. You've heard it from our COVID-19 response director and our public health officials. We must remain vigilant in the fight against COVID-19. Wear your mask properly. That means completely over your nose and mouth, not on your chin, not hanging off your ear, and certainly not in your pocket. Practice social distancing. Wash your hands. Use disinfectant hand sanitizer that's made available. Avoid large crowds. Make sure you're social distancing, especially if you are indoors. Be mindful of your interaction with others. Get a test if you have been exposed to someone who may have COVID-19. Get your flu shot. And before we take questions from the media today, I wanted to go over 2 other important topics. Social service. First, I want to talk about the Nevada Resilience Project. We know people are hurting, and this has been a difficult year. I want to remind all Nevadans that mental and emotional health resources are available. The Nevada Resilience Project, NRP for short, launched earlier this year and has resilience ambassadors located with our trusted community service providers all across the state. The goal is to strengthen our state and project focus on promotion, prevention, and early intervention. We know that people are feeling more anxiety and depressions, but in Nevada, we have built a plan to help our citizens develop their resiliency, learn coping mechanisms, and find support. Our resilience ambassadors are working on the community level with existing agencies to provide coping strategies and stress management to the communities that they are a part of. A new website for the project is launched, and I encourage you to check it out at nevadaresilienceproject.com. Social support services. I'd also like to share some very valuable information about housing resources available within our state. There are currently federal eviction protections in place from the CDC that cover those who qualify. This is an opt-in program, so tenants must fill out a declaration form provided by the CDC. If you need help filling out the form or you think your landlord is inappropriately trying to evict you, you can see help from your local legal aid provider. More information on where to find this form and how to fill it out are available at the websites on the slideshow. If you are fearing eviction, there's help available. You can apply for rental assistance here at housing.nv.gov. And Clark County just launched their own new and improved portal to apply for assistance. You can find that on the Clark County website. As many Nevadans know, this year there was new legislation passed during the second special legislative session that allowed the Nevada Supreme Court to stand up a new mediation program so landlords and tenants could resolve their disputes themselves instead of arguing in a court, thereby reducing the number of people in the courthouse during the COVID-19 pandemic. It is extremely important for tenants to file their answers and opt into mediation to try to solve these disputes. So please know that help is out there, that there are resources available for Nevadans who may need it. A few more things I want to add. There is an app available, the COVID Race, on your phone. I encourage everyone to put it on your phone. It's free, it works, it's effective. Secondly, we have, after today, 2 more days of early voting. I encourage everyone to get out and exercise their right to vote, whether they vote at an early voting site, whether they drop their ballot off at a drop box, or whether they vote in person next Tuesday. Third, please get your flu shots. We need to do everything we can to make sure that we do not overwhelm our emergency rooms with flu patients this year. So please use this opportunity to get your flu shots. Thank you, everybody, for tuning in, and now we'll be happy to take a few questions. Hi, welcome back.
The president said today he made some about Nevada's election ballots in the trash that they were floating around and alleged that you were part of a political club, which was a concern. What do you have to say in response to those comments?
Okay, I didn't watch the president. I hope that he wore a mask if he had an event. I rather doubt that he did. And I would have hoped that he would have gotten into a discussion about how much we need another stimulus package coming from the federal government in an organized plan, neither of which we've seen. But I don't have any comment about his, I don't know what the comments specifically were, so.
Do you have any response to him saying you're part of a
Well, if he means a club that I'm a Democrat, I'm a part of that. I'm a Nevadan if I'm part of that club that he's talking about. I don't know what club he's talking about. I mean, sometimes he gets talking about things and I can't follow exactly where he's going. But those are the clubs that I'd be a member of if that's what he's talking about. But I don't have anybody's ballots. I've never seen or found any ballots in a garbage can. And I think sometimes this is just exaggerations.
On the eviction point that you made, about a week out from having the eviction moratorium lifted, I think there's some concern that people are going to challenge the limitations of the CDC moratorium. Do you feel like we need to instate?
I thought the CDC moratorium went later. I thought it went till the end of the year.
Do you feel like we need to add the state level protections in case?
Is any rollback of the CDC moratorium, or it's narrowed in any way by any rulings in court?
Yeah, well, right now I'm not looking at, frankly. I mean, the Supreme Court has got the our mediation program in place. I'm hopeful that that will work for most people. We'll have to follow along and see how that goes and see if there's any problem before we make any changes to our directives.
Let's go to the next question, and if we could try to do one question at a time, please.
Hi, Governor.
Bill, how are you?
I'm fine. How are you?
Good.
So sticking on the theme of politics, Vice President Pence will be in Reno Airport tomorrow at a rally. The venue has signed an agreement with the airport to limit the audience to 250. That seems improbable. I was wondering if you think that's also the case, then will a fine of a couple $1,000s, is that really enough of a disincentive for somebody like that?
Well, hopefully the vice president coming to town as a guest in the state of Nevada, he will follow the rules. He'll wear a mask, he will practice social distancing, and he'll abide by our guidelines for the volume of the crowd, the capacity, and the social distancing. If the airport and or operator or landlord of that facility choose to not follow those guidelines, there are authorities that'll, take appropriate actions. But I would hope that the bigger guideline, and obviously sometimes these dollar fines don't make an effect on them. I would hope that knowing that he's putting the health and safety of 3 million Nevadans at risk by what could be inappropriate behavior would be enough of an incentive to have him follow those and not give the impression that he doesn't care about the residents of the state of Nevada.
Do you think that some of the,
Sorry, Bill, I just want to make sure your mic's on so the folks listening can hear.
is it on? Okay. Do you think that some of the comments that are made when the Republican, the head of the ticket and person come here, that it's directed at the state, is that just to gin up a kind of a dispute with you?
I don't know what their intention is, if they want to gin up a dispute with me. I mean, I hear this regularly. I see it on social media. I try not to follow it. My kids sometimes bring it to my attention, or my mother will see that stuff and tell me. I am interested in protecting the health and well-being of all of our residents. I'm interested in doing what we can to control this pandemic and at the same time open up our economy. And I wish that they would be interested in the same thing. I've argued for 8 months for a national plan to distribute, tests and vaccines in the future and PPE and whatnot. To this date, it has not come. And they can say it has as much as they want, but it hasn't come. And whatever they say, it rolls off my back. I am continuing to fight for the health and safety of everybody in the state of Nevada and to get our economy back on track.
Thank you.
Thanks,
Thank you.
Bill. We'll go to Sam next.
Hi. Caleb, would there have been more counties flagged if we hadn't switched how we calculate test positivity to the test encounter method?
I thought you were going to ask something else, Sam. Would there have been more counties flagged if we had not gone to the test encounter method?
Well, it seems like those changed the positivity rates somewhat substantially. Was there any thought about changing the metrics to follow that change?
So as you know, two parts to that answer. One is we at a recent task force meeting, we reduced the total number of tests that a county needed to meet per 100,000 from 150 to 100 because of some concerns that had been mentioned by especially some of our more rural communities. And so we did adjust that in order to meet their needs. But the testing encounter decision was really made in order to incorporate the appropriate number of tests and to make sure we were deduplicating nationally. In fact, we just got off of a call with Johns Hopkins University where they were commending Nevada for being one of the very few states to transition to testing encounters instead of overall tests, which was a really positive thing for us. I have not done an analysis yet to determine whether or not the change would have resulted in a difference, but I know our state biostatistician could provide that very quickly.
Thank you.
Sam, it's Julia. Do you mind if I add just
No,
a little
please.
bit on that? So just looking at the data from last week, potentially one more county could have been on based on a 7% positivity. I'll let you know that tomorrow at the task force, there are changes related to which counties will be flagged. So encourage people to watch that. I'll just add just a little more specifics about encounters. One of the things that we saw is as different types of tests hit the market, we wanted to ensure that we're not double counting tests. So if an individual goes in and gets 2 specimens collected, one is provided in a point of care test and then one is sent to the lab. It didn't make sense to count that as 2 separate tests. It would appear to be 2 separate individuals. So we thought testing encounter was just a better methodology.
Governor, it seems like the Great Balancing Act is somewhat a departure from your prior messaging about following the science, at least in messaging. Has your perspective on balance changed at all throughout the course of the pandemic?
Not really. I'm learning as we go through this. I think when everyone would admit, if they were being totally candid with themselves 8-9 months ago, we never thought that we would be here today at the first almost of November, still in this situation. You cannot keep the economy shut down forever. And it's my hope that we continue to, and people say open things up. Everything is open except for one school district in Southern Nevada. Most things are open right now, currently now. What we need to do is to have people make the choice. As I said at the meeting on Monday, if you want to go watch your grandson or your granddaughter play basketball, wear your mask. If you want to be able to go to a concert or a football game, wear your mask. If you want to help create jobs in the state of Nevada so people can support themselves, wear your mask and social distance. It's up to us to determine the direction that we're going to go in.
Thank you.
May I add to that, Governor? I'd say we absolutely are continuing to follow the science in these decision-making processes. Just last week, Dr. Fauci from the federal government talked about the need to continue to make sure that opportunities to participate in the economy, participate in education, and so on are absolutely essential, and that we do know from science and from experience, as the governor said, we do know exactly what it's going to take in order to stop the spread of this disease, this virus. And if we can implement that collectively, then we can continue to move forward with the economy open and otherwise.
Okay, we'll take the last 3 questions that are up there.
Mr. Cage, I know going into tomorrow with Washoe County, you do a lot of analyzation. Coming into tomorrow, do you have any idea or some comments on what things you may have kept them in the high risk classification for the last 5 weeks?
Thank you. This is Caleb Cage. If I understand the question correctly, we've had a number of conversations with the health officer, the county manager, and others within Washoe County, a number of them, several of them just today, in fact, regarding that very question. And as they have pointed out a number of times in those conversations, there's no smoking gun source. There's no employer. There's no one organization or one activity that's leading to this. What they're seeing is generalized community spread within Washoe County right now. Now that means a number of things. First, it means we can as individuals, as a resident of Washoe County, my family and I can take measures to wear a mask, to make sure we're social distancing, to do all the things that the governor talked about. And I'm very much looking forward to hearing their plan, their collective plan and proposal tomorrow when we meet in the afternoon.
Do you believe then, in this case, coming upon this, and Governor, this can go to you as well, that more restrictions are coming for Washoe County? Can you tell that to the residents, or is it still leaving things up in the air?
You asking me that question?
Yes.
I know that the elected officials in Washoe County care about those residents as much as I do. We made it clear at the beginning, we gave them authority, and they had authority to ask to loosen things up or to have some more stringent regulations in place. 5 weeks is a long time to be on that list, and I am confident that they will come forward with a plan to help reduce these positivities moving forward. They'll come up with something that'll work.
So you do believe more restrictions are coming?
I believe that they will come up with a plan, whatever that might be, to make sure that we can somewhat reduce this spread of the disease. Yeah.
Thank you. Again, that task force meeting is tomorrow at 1 p.m. We'll do
I
the
think
last 2 questions.
I think you may have just answered my question, but your expectation is in that meeting in Washoe County with the school district and the university and the local officials, you expect them to come up with a plan tomorrow.
I certainly do.
How will that be announced? Will it be announced individually by those entities? Will it be announced through you, or?
Well, I'll leave that to Caleb and Julia. They're going to handle the meeting tomorrow, but I would assume that they will come and give presentations and say, we're going to do A, B, C, D, that we hope will help reduce the spread. But I don't know, Caleb, you want to?
Yes, Governor, that's exactly right. And I know they're actually meeting right now, and among the various jurisdictions to finalize that plan. And we look forward to getting that later this evening.
Is there an approval process that they have to, you have to clear the plan, or?
So according to the Road to Recovery framework that we put together earlier this year, they'll present that to the task force, which is made up of a number of entities at the state and local level. We will either approve the plan, we will modify the plan, or we will deny the plan tomorrow at that meeting.
Okay, thank you.
Yes, sir.
Thanks. We'll do last question. I think Zach.
Thanks for taking the question, guys. There's been a repeated narrative at the last couple debates from President Trump and also campaigns here locally that we're on the mend. Things are wrapping up. The virus seems to be in a good direction. You, the medical professionals here in the state of Nevada, for residents that are watching these debates, attending these rallies, are we on the mend? as the medical leaders here, is this a narrative that is true from the eyes of science?
Before we let the medical professionals go, and I want them to follow up, we are not rounding the corner. I don't care who says it, we are not rounding the corner. You can see from the slides, our cases are going up. Anyone that says to the contrary is just not telling the truth. No, anyone who says the contrary is lying. They're trying to intentionally deceive people and have them let their guard down. We cannot let that happen. We need to be more vigilant than ever to step up everything that we did. The choice is ours. As I said, you want to go to your kid's football game, or you want to go out with your buddies and play basketball. We can do those things if everybody would just follow the regulations, the protocols that we've put in place. If you don't want to follow them, we're not going to be able to do more things. But listening to somebody with their hyperbole or their philosophical ideas, or frankly, their lies, isn't going to change the fact that across this country, the spread of COVID, the cases are increasing. You can look at any show and see that that's the case. Somebody telling you it's not so doesn't make it not so. So I'll leave that to Caleb and Julia.
Julie, would you like to go ahead, or you want me to? Okay, I couldn't agree with the governor more. We are, as I said in my remarks, that we're experiencing a 7-day average nationally of over 70,000 cases. Our situation here in the state of Nevada parallels that from a local perspective as well. And as we laid out in our remarks, when we see cases, we know that within 2 to 3 weeks, we're going to see hospitalization. And within 2 to 3 weeks after that, we're going to see deaths. So that is the trajectory for a typical, for a number of the COVID positive patients here in the state. What I'd add to that is that narrative is exactly that. It's only a narrative. It does not reflect the truth or the reality that we're experiencing in this country or around the world at this time. And I would say that narrative is deeply disrespectful to our healthcare workers who are on the front lines dealing with this every day and who want to go home and see their partners, significant others, and their children, to our teachers who are trying to make sure that they're having meaningful opportunities to educate their children, and to everybody else who's working extremely hard to keep this economy open.
Agree with both of those comments. I'd say that in public health, we're incorporating COVID into our forever response. There won't be an end to COVID. Hopefully vaccine will get it to levels that we can control. The best way I could describe it is that COVID is truly a controlled burn in our community. And if we can keep it at levels where our hospital capacity is healthy, where we can case investigate and contact trace all the cases and people isolate and quarantine, it's going to be like any other infectious disease that public health has been responding to for forever. At the point the cases grow too quickly, it becomes a wildfire. And as you can expect, then we have to prioritize what cases get investigated and contact trace. And so in public health, we are trying our best to ensure that it stays a controlled burn and that we can handle it. But that's individual responsibility to ensure that they help us. And so I do think it's a very destructive narrative to say that we've rounded the corner, because for us, we're in this for the long run.
Let me give you the anecdotal. We just built a stadium in Southern Nevada that's going to be home to the game for the Fremont Cannon on Saturday. That stadium seats 65,000 people. More people every day in the United States, every day, than the capacity of that stadium are contracting this disease. 70,000 people a day. I talk to my fellow governors, my colleagues. They have to look at restricting rationing care in some states. That's how overwhelmed hospitals are becoming. They have to look at maybe transporting patients out of state because there's no more room in their hospitals. And if anybody thinks that that means that we've got a handle on this or it's going to go away in a few days, they're dreaming or they are lying to the American people. It's that simple. And I'm not going to allow that in the state of Nevada. We're going to do everything we can to protect all of our residents and at the same time protect our economy. So with that, thank you.
Thank you for your time.
Great. Thank you everyone for coming out, and have a great Nevada Day.